Next question. My name is Dr. Ben Newman. I'm a coronavirus researcher, as in, I actually research coronaviruses. I'm not from some other discipline coming in and, trying to weigh in on stuff. So these are my professional opinions based on the papers that I've read and some of the work that I've done. So, all right, let's go. Let's see what questions. Yeah, the dog has dragged in this morning. Yeah, this one's from Susan. Good morning, Susan. Yeah. um, Hi, Dr. Ben. I just read an article in the Wall Street Journal about a potentially promising therapy for COVID-19 called medicinal signaling cells. Okay, yeah. Any merit to this? And then there's a link to an Apple News version. Because, yeah, I think the Wall Street Journal may be paywalled, but whatever, yeah. So I clicked on this just a little bit ago, and I thought, that's weird. That sounds like, I don't know, it sounds like PR. It doesn't sound like science. The word medicine is one of those words, like quality, that kind of doesn't have a meaning. It is only used as an appeal to your sort of emotional tugging on those heartstrings kind of thing. Yeah. Like bespoke. Yeah, just yeah. It's kind of a nonsense word. This thing for you. Yeah, it's bespoke. Yeah, okay, sure. Yeah. It's an appeal to emotion, basically. And so, yeah, normally science tries to stay away from that because if you have appeals to anything other than cold hard logic and data, then you are basically misleading, or you are at risk of misleading. That is something that can happen. So, um, what these things were called before are mesenchymal stem cells. And there's one particular doctor who has been writing paper after paper. And the papers are just, it's time that we change the name of mesenchymal stem cells. We need to call them medicinal signaling cells. Yeah, that's just over and over. This is his thing. Yeah, that's fine. Yeah, it can be his thing. But yeah, like, okay, I've got it. But I would say that's a less useful name because you're putting right into it that these are medicine, which is an appeal to make the average person think that these are going to cure something. Or in the case of these cells, they are basically claimed to cure everything. Yeah. And that's one of the rules in science is that there's probably nothing that cures everything. There's nothing that is all good or all bad. And everything is real contextual. Everything is real specifically dependent. Like one exact situation, yes, you might be able to get something done, but to even find some kind of drug that works broadly, like in all of the adults, from all the different parts of Earth, difficult, very difficult. And to find something that works for multiple conditions, suspect, probably not real. And to find something that is like almost a miracle cure all for very different conditions, almost certainly this is wishful thinking rather than science. So, from what I've been able to tell, and we're outside of coronavirus virology, so you have a scientist's opinion, not an expert on medicinal signal. That's such a silly name. um, so these are basically stem cells that are injected at different points. I know there are some papers that I've read where stem cells can actually have a big effect. For example, I think in spinal cord breaks, putting in the right stem cells, not just any old stem cells, can lead to repair of some of these breaks. It works pretty well in animals. I think it has also been done in humans. Doesn't work every time, but is probably the best thing that we have for a condition like that. The idea that putting in random stem cells could make COVID-19 better is super weird. Yeah. So the problem I would have with this is that a person is full of stem cells. We have them buried in most of our tissues, and they're running around and doing things. Even when we're old, we have plenty of stem cells. They just don't work quite as well at repairing stuff. But they do repair, actually, fairly well. Yeah, which is why we're able to live to 80, 90, 100 years old. And so you're going to take a person who has their own mesenchymal stem cells that are not stopping COVID. You're going to inject either stem cells from that person that you've prepared earlier, which, good job, assuming that they would get COVID, taking the stem cells out, growing them up in the lab for a couple weeks, so that they'd be ready. Yeah, that's proper forward thinking. Or you can put in mesenchymal stem cells from somebody else, from a different human. Problem there is that's effectively a transplant. And so to keep the body from attacking, destroying, and rejecting those stem cells, you would have to basically go on immunosuppressive drugs to keep your immune system down because you're getting a transplant. It's like kind of like a bone marrow transplant. Similar idea there, or a low-grade version of an organ transplant, kind of a more temporary thing. And again, I don't see how shutting off, when they take those immunosuppressives, what they're doing is letting the sort of low-grade part of the immune system, that's allowed to run free. That's the part that actually causes the problem in COVID. Things like neutrophils and macrophages just keep overreacting and multiplying this reaction in the people that suffer from either bad disease or death. That's generally what happens. And the people that do well with coronavirus, generally they make a pretty early adaptive immune response. That's the side that's shut down by anti-rejection drugs. And so that's why you'd be taking away the helpful side of your immune system and letting the side that malfunctions and causes basically severe COVID run free. And yeah, this is bonkers. It says in the article, to his credit, that everybody wants these and nobody can get them. And once again, that sounds like a carnival barker or something, a real step right up. Yeah, you gotta see this. You gotta, try this. So I think this is a product of wishful thinking. I don't see a clear mechanism for how this could be useful in any way in COVID-19, but it doesn't matter what I think, it matters what the data shows, and as soon as there is a decent-sized clinical trial on these goofy medicine cells. Yeah. Those are medicine cells. That's not a thing. As soon as there's a good clinical trial, please pull that up, send it to me, because I probably will not see it otherwise. And yeah, let's have a look at it and see what they do, if they do anything. But yeah, right now I suspect no. And it's nice. They're selling hope, and people need hope right now. But there are a lot of things, like some of these anti-immune system biologics, that are, I think, promising enough that they are worth trying, and they have a very direct mechanism for how they could at least potentially help in COVID-19. And so, yeah, I tend to go with the ones where there's a more of a direct path to them working. Those are the ones that I just conceptually think are more likely to pan out in the long run. Pipe dreams occasionally work out, but that is usually not the case in biology. So there we go. That's my professional opinion on this as far as I can give it. This has been Ask Dr. Ben.